Hey everyone, this is Mary from the Renee Jones Empowerment Center, Sexual Assault Nurse Examiner. I hope everyone is doing well. Hey, the reason for this video today is to talk about depression. We all get sad, right? Sad is when, you're feeling unhappy. It's usually due to something that's bad happening, like losing a loved one, a breakup, or sudden illness or other tragedy. And that's okay to be sad. But when your sadness lasts longer than a few weeks, then you could be looking at depression. Some of the signs and symptoms of depression: severe headache, digestive issue, feelings of hopelessness and worthlessness, and you just can't seem to get out of this dark pit that you feel like you're in. Severe anxiety, you're not sleeping enough or you're sleeping too much. You're not eating enough or you're eating too much. And these are some of the things that can happen that can signify and indicate depression. So what do? You call your physician. You get your physician on the phone and you tell him or her what's going on with you, and be honest, because that's the only way they're going to be able to help you. And they may ask you questions like, do you feel like hurting yourself, or do you feel like hurting someone else? And depending on your answers, they're going to tell you a couple different things. Either A, go in and see them, or B, I'm talking apart the COVID virus, or B, go to the hospital and get checked out by a physician. Once you get to the hospital, you'll be checked out by a regular physician, and then a psychiatrist, maybe a psychiatric nurse, and a licensed social worker. They will come in and they will talk to you in depth about what's going on. What happened to you that is so bad that you just can't seem to pull yourself out of it? And we all get sad, like I said, losing a loved one, and that can hurt us to the core. But if that's lasting for longer than a few weeks and you just can't seem to get away from those thoughts and everything, that's when you really do need to get some help. So when you get to the hospital and you talk to the physician's going to decide what he or she wants to do. They might just have you get into a support group, which is really good, because when you get into a support group, you're with other people who are depressed. You'll be amazed at how much they're going to sound just like you and how much the symptoms match. And that's a really good connection, and that's what you want to have, because then you're more apt to open up. They may have you just talk to your family members. Ask you, is there a family member you can talk to? Is there someone that you're close to? Whether it's a parent or a brother or sister, because you've got to talk about it, right? You can't shove it down, because the more you shove it down, it's going to come out in other ways, through drug abuse and alcohol abuse. And sometimes that's how people treat their depression. And I know that gets us through the moment, gets us over it, gets like, okay, I can handle this, life is good, but it doesn't. So try to stay away from the drugs and the alcohol. Get plenty of sleep if you can, and the physician will talk to you about that. Get plenty of exercise, even at home, and make sure you eat a well-balanced diet. If you eat a lot of foods with carbohydrates and fats, you're going to feel sluggish, and then you're going to feel guilty for eating all that. And you see what I mean? It's just kind of dominoes like that. So the biggest thing, I just want to tell you this again, is please make sure that you're honest with your physician. Now, the other thing that they might do is they might tell you, okay, you know what, we have to put you on a medication. And it'll take a few weeks before that medication kicks in. And they're probably going to do some blood work too to see if that medication they want to put you on is going to fit. Being depressed does not mean that you're crazy. Now, back when I was coming up, that's what it meant. And it does not mean that you're crazy. What happens, it happens in your brain when these chemicals come down in your brain for whatever reason, and we get depressed. What happens when the physician puts you on medication, if they deem it's appropriate, they put you on medication, those chemical levels start coming up and you start balancing out. Does it mean you'll never cry? No. Does it mean you won't get sad? No. What it means is that you'll be able to handle situations a little bit better than what you were. You'll be able to see things a little bit clearly. And I want to put this in here quickly, is that many times when you try to talk to some people and they'll tell you how you're feeling, they'll tell you, get over it, tough it out, deal with it. Well, this is what happened to me and I got past it. No, that's not true. It might happen for somebody, but for the majority of the people and the majority of my patients that I have seen, that does not work. The things that work are talking about it, seeing your physicians, possibly a support group, possibly getting on medications. So I want to make sure that I put that out there, because people still say that today. And what will happen is the medication, if he does decide to put you on medication, it's going to take a few weeks before it hits and it starts making you feel better. But the thing is, your family members are going to start seeing it before you do. And they'll start seeing you're more lighthearted, you're laughing more, you now want to more, join activities that you weren't joining before. You're coming out of your room more. So your family members are going to see that before you do. And so all of this together, depending on what your doctor wants you to do, is going to help and get you out of it, because you can't stay there for a long period of time. And depression is extremely common. I think like 264 million people globally suffer from depression. So it's not something that's unusual. People get depressed, people get sad, but like I said, if that sadness is lasting more than a few weeks, then you could be looking at depression and you need to get the help. And you're going to do that by calling your physician, right? And you're going to be honest with that physician, right? So please heed that. That's extremely important. And I found this little quote that I want to read to you. And it said, "I think that little by little, I'll be able to solve my problems and survive." And that was by Frida Kahlo, who was a famous Mexican artist. I also want to give you this number. This is a suicide hotline number. It's 1-800-273-8255. 1-800-273-8255. Even amid the coronavirus, even the COVID-19, it is staffed 24/7. So you can call these people. They're awesome, and they will keep you on the phone as long as you need to be on the phone. And then depending on what you say, they might direct you a couple of different ways too. Okay? And I want to add this as well. Don't give up. Please don't give up. The world's a much better place with you in it. You might not think so, but truly it's a much better place with you in it. So please don't give up. And I have to add this, of course, is stay healthy, stay safe, and stay home. And until we talk again, everyone, take care. Bye.